I'm here. I made it. I made it. Good evening, viewers. Thank you for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Givens, and I am your host. I'm glad I made it. Um, Again, thank you so much. This show is about health awareness. We're addressing health issues, social issues, and it's brought to you by Georgia Doty Comprehensive Health Organization. It's a nonprofit organization that has been serving the Chicago community for 20 plus years, doing some great work in the community, being a health advocate, connecting the community with access to quality health care, educating the community, really promoting the idea and the information so that our communities can live much healthier lifestyles. I am honored to be the host. Um, I am really ready to get into this conversation. We are all experiencing it. It is affecting all of our lives here across the country as well as worldwide. This is unbelievable for me as well as I'm sure for most of you. And we've heard about it. We've read about it. And I don't know that we still really understand what is going on. But I'm happy, to have these guests that were willing to come and talk to us about the COVID-19 and just about community health overall. I definitely, before we get into the conversation, want to give a shout out to the founder and CEO of the Georgia Doty Comprehensive Health Organization, Mr. Don Doty. And I have to also say hello to him and his wife. Hi, Mr. Doty. Hello, Miss Joyce. So I like to get right down to it. I am here representing the community, representing just the everyday person. So if you have any questions, we're on Facebook Live. We'll try to see if you have any comments. We'll try our best to see if we can see it and get to it and see if we can respond to your questions with an answer. So I have three guests. I'm real excited about that. I want to get into this conversation. It is a very serious conversation, and even for me, a heartbreaking conversation because it touched my life personally. We'll talk about some of that. So I have three guests. I have Commissioner Dennis Deere, who is the commissioner for the 2nd District of Chicago. Thank you, Commissioner, for being here. I am so honored
You're
to
welcome.
be able to have the opportunity to meet you virtually and have some conversation. We also have Mr. Jack Orlov, who is actually the chairman for the Georgia Doty Comprehensive Health Organization and is an advocate of quality health care as well. He's been in the field. He's a professional in the field. He has his own area of expertise. So that's how you doing today, Jack? And lastly, which is critical and so important, that we are able to have with us a doctor. She is the chief clinical officer at Loretto Hospital, and I just want to make sure I get her name correct. Dr. Giovanni. I'm not sure if I'm saying that correct, so please forgive me and please correct me. But we are so thankful to have you here with us as well to talk about community health and to talk about COVID-19. So before we get into the conversation, again, thank the three of you. I like to be really informal as we begin to chat. I'll think about things that the community may want to know, that they may want to ask, and feel free to jump in and share with us and the viewers anything that you feel is necessary. This show is about education. It's about raising awareness. It's just about making a connection and even providing some resources if we're able to do that. I want to start off by giving each of you just a minute to introduce yourselves and give us a little history about who you are. And we'll start with Commissioner Deere.
Sure. Thank you so much for having me on this evening. It's always a delight and a privilege. I've known Mr. Doty for many, many years. My name is Dennis D. County. My district runs from the west side, from Laramie on the west side to downtown to 75th Street on the south side. I have some of the poorest and underserved communities, but also some of the richest communities. I am a psychologist by training. I have a PhD in psychology, but I'm also a commissioner. A lot of my work has been around healthcare and reentry. I'm actually in the congressional records as one of the architects of the Second Chance Act, working with individuals who have backgrounds. And so I'm delighted to be here. I have about 3 task force that I focus on, that is public health, economic development, and public safety. I'm also chair of health and hospitals for Cook County. I have a seat on the Cook County Health and Hospital Board as well. And I enjoy working with underserved communities and helping them to get access to health. And I'll stop there.
Okay. That's a lot. It seems like that you are doing some great things for the city of Chicago.
Thank you.
And so Jack is next. If you could share a little bit about you.
Sure thing. My name's Jack Orlov. I'm president of Right Healthcare Ventures, and I'm the chairman of the board for the Georgia Doty Comprehensive Health Organization. I've been involved in healthcare ever since I graduated college, and have been in the medical supply business, the durable medical equipment business, the pharmacy business, therapy business, etc. And have had the pleasure of working with Congressman Danny Davis in his district, with Commissioner Deere. We just got to be participants in his census development and health fair out in the neighborhood. And the goal of Georgia Doty Comprehensive Health is very simple, is bringing more education, more advice, more connections, more services to the underserved communities so that they can get the health care and the education needed to live hopefully a much better life. And COVID-19, unfortunately, has put a true focus on how bad it's been in those communities for the underserved populations and the Black and the Hispanic groups having double, triple the needs and issues that we have elsewhere. So hopefully we can make an impact working with everyone.
Absolutely. And I know the organization, I know firsthand, is very appreciative of you being the chairman, and just your contributions that you've made since you've been chairman is really appreciated. So last but not least, let's bring the doctor on to share a little bit about who she is.
Hi. So you can call me Dr. Nikki. It's way easier to say, but Dr. Nikki, yeah. And so I'm an internal medicine physician, which means I treat adults, anybody above 18, with any general medical problems, and direct their primary care. You would call me a primary care doctor, or a doctor that you would see once you're admitted to the hospital, that kind of coordinates all of your care. And then to tell you a little bit more about myself, I have always worked in underserved communities. I worked in 2 safety net hospitals on the west side of Chicago, the first one being Mount Sinai, and the second one, which is I'm at right now, which is the Loretto Hospital in the Austin neighborhood. I guess we're just on the edge of Commissioner Deere's area, right on Central and 290. We are a safety net hospital, which means that we have a more than 50% Medicaid population, which, as you know, would be the most underserved population there is, with the majority African American density in that area. And so I'm the youngest chief clinical officer at Loretto Hospital.
Nice.
Yeah, and I primarily work both with the patients, but also in coordinating community care, in taking care of case management, trying to make sure that we can get enough money from the government to pay our bills and take care of our patients at the same time, and keep our hospital running, along with my CEO, which some of you may know, Mr. George Miller, who's been doing some great work to work with our legislators, especially on the west side of Chicago, to get us enough funds for the community and for their hospital to continue to be alive and stay there for who needs us in the place that they're from. So.
Thank you so much. Well, for a person like myself, whose whole platform is about women empowerment, it is definitely an honor to have you here as one of the guests. So I want to get right into it. And the conversation will be all of us. I'm going to, just jump right into it. COVID-19, it seems like it hit us out of nowhere. Some of us have seen videos and heard the conversation have been happening way before this year, but for us, it came out of nowhere. So, and it has really been devastating to our communities, to our families, to our city, again, across the country. So I just want to begin by asking, and I want to start with the doctor. What is different about COVID-19? Because we hear virus, and prior to this, we have viruses all the time. They come, they go. Yeah, we pass them, but we kind of get over it.
Right.
What is it about COVID-19? What is it about the virus that's different?
So first of all, it's the fear of the unknown. So first of all, the origin, it came out of what we think is nowhere. We didn't know a lot about it because of kind of the secrecy surrounding how they were being treated or exactly the numbers that were going on. But also the way the virus travels is still being investigated, for example. So we are continuously, people ask me all the time, why do things change so much? We're continuously finding out more. And it seems like this virus has characteristics that combine different viruses or different things that we think we know. So, for example, people like to tell me, even though I'm not old enough to remember, but it seems apparently like how the AIDS virus the HIV virus was first thought about. A lot of fear, a lot of apprehension, didn't know how to treat it, didn't know how to get there. Same thing with COVID. What does treat it? How do we get to the bottom of it? How do we get a vaccine? For example, influenza has been around for a long period of time. So you'll see in your history books, 1918, the Spanish flu, that was influenza. So by the time modern medicine came around, there was enough to say that, okay, we know what we're talking about. It might change here and there, but at the same time, it's essentially the same. This is a whole type of different virus. I mean, this what we call a coronavirus is a broad group of viruses. And that's why they changed the name to COVID-19 to specify more what it was. Coronavirus in a general group is not as harmful, not as bad, but there's particular changes in the way this virus was built that it infects different types of cells and infects them at a faster rate than you can possibly imagine. And it causes, normally viruses, you can, how do I put this? You can, if somebody's oxygen level is going down, you can tell and you can say, okay, somebody's not doing well. This virus sometimes has characteristics where they'll be smiling at you, they'll be talking to you, but their oxygen level is very low. And so they deteriorate very fast and you won't know. So, I mean, I don't want to go on too much, but basically it's a lot of different things that the healthcare community has not faced. And the main thing is the spread. The main thing is the spread, how fast it spreads, but also how it spreads in different places. Sometimes you'll see people going to a party and everybody gets it. Sometimes they don't get it. So what is it? What is causing that? For example, influenza, somebody coughs on you, the droplets fall on you, you get it. But you don't know that about COVID-19. It continues to change. So.
Got you. I got you. Thus the mask, the social distancing, because we really don't know exactly how it's being transmitted.
Right. And that's the thing. We had to start somewhere. So we want to make sure that we do the mask and we do the social distancing. And while we find the treatments that are going to get there. So once we find the treatments and the vaccine, yes, things will be back like any other virus. But until then, we have to do what's there. Washing your hands, social distancing, the mask, things that we know work for every other virus. And if you see 1918, see pictures from 1918, there are people wearing masks even back then. So why that we can't do it now when we've always known this for about 100 years or more? So
Right. Okay. I'm going to go to Commissioner Deere for a little bit, and just since we're so this is an issue of public health and community health. How what role have you in your district, or even just the board of commissioners, played in the decisions being made to try to keep our city and our community safe?
I think that's a great question. And first and foremost, let me say that I think the doctor gave an excellent breakdown of COVID. I haven't heard it broken down like that
Right.
ever.
The point
So
of the
thank you,
show.
doctor.
That's the point of the show.
I appreciate that. That I've heard it a lot, but not like
Yeah.
that.
Yeah.
Thank you for your ability to transfer information. Um, of course, you know that here in Cook County, we represent 5.2 million individuals. And so when you ask about from a public health standpoint, our public health department, which, you know, I am chair of the committee that provides oversight of it, has been the point for dealing with COVID in Cook County. And so all
Okay.
of the testing and all of the education and all of that has come through our department. We have been attempting to target as many underserved communities as we can. Why? Because we know that COVID has impacted underserved communities a lot more than it has everyone else. Blacks
Right.
and Latinos have been impacted by COVID at a level that is just incredible. And so at Cook County, we've been trying to approach those particular communities and those populations. Obviously, Cook County is a safety net as well. We are the largest public hospital in the state of Illinois. We provide about 49%, or no, 51% indigent health care, which means they don't have ability to pay, uninsured. And so we know that the people that are coming to us are underserved, and they really, really need the help. In addition to that, what I've been doing is keep in mind Cook County, our focus is really Cook County and the suburbs. The city of Chicago has home rule. Well, my district is 100% city. We had many areas in my district that didn't have testing, right? And so I focused on trying to get testing sites on the south and the west side. In fact, I had a testing site actually at my office. Howard Brown brought their mobile van over. Jack was over there. We had food, we had census takers. And guess what? We were asking individuals to come over and get their COVID testing done. And I told individuals, look, now I don't have any symptoms or anything like that, but you could be asymptomatic. So I said, I feel good. I will take the test if some of y'all take it. And I think we got about 15 people to take the test that day. I took it. Thankfully, my test came back negative. I'm not sure what happened with the rest of them, but the key is I've been trying to get individuals to get tested. And the reason why is because this thing spreads so quickly. And I know a lot of people who have perished from it that are African American, that are from underserved communities, and people looking this home to their parents who are senior citizens, and they're dying. It is incredible. I mean, from March up until now, the number of people that have perished because of this is just incredible. And so that's what we're doing about it. Oh, let me add on. We've provided housing through CARES funding that we've gotten. We got something like $400 million in CARES dollars that we've provided housing and hotels for first responders and those who have COVID and need someplace else to stay, or family members. So we've done that. And we've also assisted with some of the cost of testing. And so the goal is I have focused in on Cook County to help those who cannot help themselves and to be the voice of the voiceless.
Okay, that's good. Great. That's great. But you said something I'm gonna go back to the doctor and ask her a question while I'm thinking about it. What is it? Two questions. One, should we all just go get tested, whether we're having symptoms or not? And two, what does it really mean when people say you're asymptomatic? What help the viewers understand what that means?
Okay. So that's great, Commissioner, here, because that's exactly the point that I do want to make on this segment, First of all, we commend you for doing the free testing at your site, because we are doing the same thing at Loretto Hospital. We've tested 10,000 people for free so far in our tent outside in the predominantly African American communities and the Hispanic communities around us. And what we've said is, when we started our site, we said the exact same thing Commissioner Deere said. We said, come and get tested no matter who you are, what you're doing, whether you have symptoms or not, because there is a period of time before you start getting symptoms. When you have fever, cough, problems breathing, a sore throat, even something as simple as diarrhea, at least 2 days prior to that, the virus is already in your body. And the test is detected. So that's why you might not even know that you have it. And that's why they tell you to stay at home, because what if you have it and then you go and visit your grandparents and then you give it to them? So, which is why Loretto Hospital was and I can probably confidently say this, one of the first testing sites to say, we do not have any criteria, just come and get tested. And 10,000 people have shown up in the past 2 months. Wow. And it's amazing, because they all say to us, well, do you need this? Do you need that? We said, no, we barely need anything except for your name and, your address to be able to, and your email to get back to you. But we don't want to stop you from getting tested by asking you a million questions, because this virus is so new that we don't know what's out there. And we want you to be able to go back to work, visit your babies, visit your grandparents. And there's no reason. And we wanted to stop the spread in the minority communities, right? Because
absolutely,
as Commissioner Deere said, there is not enough testing sites on the south and west side. So Mr. Miller and Loretto Hospital fought to get that, and the governor and the mayor obliged. But we're one of the only people doing it. There has to be more. There has to be, because of the African American communities are the most affected. 1 in 1,300 people in this country who are African American have already been infected with the virus. So,
Right.
So we actually ended up getting one at Lawndale Christian Health Center as well. So they're in Lawndale, and I know George is my good friend. I'm glad you work at Loretto. He's my fraternity brother as well. But he has it over at Loretto. So we've been sending people there, and we were also able to get Walgreens to put one on North Avenue. So doctor, we're getting those numbers up, but we still need more testing sites.
Absolutely. So let me bring in Jack and talk to him and ask him what so from a community organizing organization, what do you see community organizations are doing, or what could they be doing or should be doing to address some of these issues?
Well, to keep the conversation very simple, testing is number one. If you don't know that you're positive, you're out there doing your everyday thing with people all over, and that's why this is spreading like it is. So everybody needs to get tested, and if we could take the positive people and set them aside into quarantine, all the negative people doing their thing, this would be controlled way, way better than what's going on. But if you don't know, you don't do. So our educational piece is to get out to the community. 1, not get people scared. 2, let people know that the more they learn, the more they know who to reach out to, then they can get these things done and trust.
Absolutely.
There's unfortunately some very negatives in the healthcare world. This is a very positive sense that we have to be out there, and the tests have to be done, and the test, hopefully the results will get back quickly. I'm working with a group now that we're actually doing a nice group of nursing homes here in Chicago, and our turnaround time is 48 hours. We get the test, we pick up the test, get them to the lab, in 48 hours they know from the staff and from the residents who's negative, who's positive, who has to be taken care of, quarantined, and who's fine to live and keep going on their life. But if you don't know, unfortunately, it's a terrible, terrible thing, because I believe the number is about 60% of the people with COVID are asymptomatic. So they have no clue, nobody has a clue, and they just go around doing their own thing. And that's very dangerous in the way that this thing spreads and kills people. Then the one that can sidetrack on the underserved communities, because of many issues and lack of resources, the nutrition is not what it needs to be, which causes a number of clinical issues like obesity, diabetes, cardiac health problems, respiratory problems. And when you look at all of those things, these are the people getting affected and killed at the highest levels due to COVID because of all those comorbidities. So we need to bring the education to get rid of a lot of those problems to help all the way along, whether it's COVID-19 or just, again, back to living a much better life.
Right. So let's bring Dr. Nikki back for a sec. I want to ask, and I don't know, you may not even have an answer, but I'm sure the viewers are all wondering, do you see things getting better anytime soon? Or is everyone going to be required to get, a vaccine once it's available? Like, what are your thoughts about where we're going to go from here?
Right. So obviously there's a lot of conversation surrounding, should the kids go back to school? Should we keep doing events all the way till December or to 2021? We cancel Lollapalooza, for example, which is a huge revenue generating thing for Chicago, things like that. But here's what I'm going to tell you. Look at New York. 2 weeks ago, they went down to having 0 deaths in one day. Italy. Look at these places that had huge numbers. Emergency rooms were swamped with patients, and now they've maintained and controlled it. Or Taiwan or South Korea. If you research some of these places, as Mr. Orlov was saying, I mean, it is a lot to do with segregating the people who have the disease once you get down to a certain level. It's all about bend the curve. So right now, for example, the state of Illinois is at a 4%. When we moved to phase 3, we were at about a 2%. So we're going slightly back up. But the reason is that the contact tracers, everything has not started up yet. So we still haven't isolated the people who are positive with the disease. While we have a low number that we currently have, which is about 1,000 to 2,000 a day in the state of Illinois, we have to isolate and quarantine to the point where they cannot spread anymore. Like New Zealand, get 0 cases. So yes, it will get better, but the only way that we know for absolutely sure it will get better is a vaccine trials. So as you possibly heard, one of the first vaccine trials that are out there has just started a phase 3, which means they just started testing on human patients today. And so we don't know if it's going to work, but we're hopeful. So it's not only the vaccine trial and manufacturing the vaccine, but once we get the vaccine, making sure that everybody gets it, no matter who you are, where you're from, what the color of your skin is, what age you are, to get that vaccine. So yes, so right now we do with the measures we have, but there is hope. We just have to follow the rules for slightly longer, and we will get through this. There's examples out there.
So as a primary care physician, for people that's saying, I'm not getting a vaccine, what if you were my doctor and I'm like, no, doctor, I don't want that. I don't even know what it is. I'm not sure. What would you say to me?
So, that's the thing that I like as a primary care doctor, because I have the time to sit and connect with them about issues just like this. So people say to me, for example, I'll give you a tiny little example. Why should I take my blood pressure medicine? It's been doing great for the past 2 weeks. I'm like, it's doing great because you're on the medication. So, why should I get this vaccine? I have a reaction to it. So then my thing is, I want them to really understand what the vaccine is, what it does, and what the alternative is, right? So the vaccine will be proven not to kill you. That's the whole point of going through months of trials and figuring it out. Number 2, if you don't get the vaccine, but then get COVID, the effects, as Mr. Orlov and Commissioner Deere said, the fact that you have all of these diseases already and you add COVID-19 on top of it, you might or might not get through it. And the long-term effects, that's the other thing. I just heard that we talked about, older people with other diseases, but very young people are getting it too. You have no idea what this disease can do to your body, but we do know for sure that a vaccine is much, much less harmful than a virus that attacks your lungs, that you can't breathe, that you could end up on a machine, that you could pass away, leave your family. Those are the type of but those discussions take time. I would like to spend that time with them. All the doctors want to have that discussion, and we're open to having that discussion. So I I have a pretty good rate of convincing people to do things, but it takes that time of talking and explaining. And shows like yours, actually, the fact that we're even having this conversation right now, and the trust that they have in their physician, that I'm not going to be recommending to you something that's going to hurt you. It's against my profession. It's against my Hippocratic oath. There's no way I would cause harm to you on purpose.
Right. Right. That's important. And when we move to that phase and the vaccine is offered, that we have relationship, with doctors, or there is access to the care that the community can trust.
Right. So we have, in the Austin community, we have Loretto Hospital. We have many primary care doctors, appointments available even now with the clinic. So you can just go to our website, call us, and we can get you in straight away this week. We can do a televisit just like this, say hi over the video. We can have a conversation for people who don't want to come in. But there's also other sites, like Lawndale Christian does a good job. I don't want to exclude anybody else, but at the same time, Loretto is a hospital. We have the lab on site. We have, everything is on site, one-stop shop for everything, and we're ready and here to serve you.
Okay. So I want to ask all three of you, for the city of Chicago and even urban metro cities like Chicago, should we go back to like phase 2 or even phase 1, or should we keep progressing? Just your thoughts about, are we in the right phase, or should we really reconsider kind of going back to stay at home for a longer period of time? And any of you, just your thoughts about it.
Well, I think that I'm comfortable where we're at, but it depends on really what the population decides. I mean, what kind of choices are they making as it relates to wearing PPE, as it relates to being safe, keeping their community safe, and if we go back to sheltering in place, are they really following the rules around that? Now, what I'm happy about is when I go outside, when I do go out, I see a lot of people with masks on. And when we first started this, I didn't see a lot of it. And so I'm really, really thankful for that. And if we stay in there, if we stay wearing our PPE and being safe, I think we'll continue to progress appropriately. But I think also, now here's the psychology part that I'm out. Some of us are conditioned to, once things seem like it's okay, we get lackadaisical. It's called systematic desensitization. When you are exposed to a traumatic incident that's traumatic at first, but after repeated exposure, it becomes a norm, right? And so that's what concerns me, because it becomes easy for you to take your mask off, not wash your hands for 20 seconds. And we got to put that away, and that's how people get COVID.
Right, absolutely. Jack or Doctor, what do you think? Are we in the right phase in the city and surrounding areas for this area?
Well, as Commissioner Dare said, the phase is one thing. People following and actually doing what that phase says is the other. So when you look at the bars, for instance, that just got closed down, the de-revenuization overlooked the keep people healthy. They had more people in there. They're closer than they should be. I saw things on TV where bartenders aren't even wearing masks or gloves, and they're taking all this stuff, putting it in your cocktails, and you're drinking and doing all this stuff. You can't do that. If we follow the rules, then we probably can be in whatever phase we need to be in. But if we violate the rules, it doesn't matter where you go. If you go back to phase 1 and everybody violates it, doesn't wear their mask, doesn't do anything, we're in the same boat. So people just have to stop the craziness and do what's best for themselves, their families, and the community.
Okay. And Doctor?
I completely agree with everything they both said, because, I don't want to name any states, but certain states are in different phases, but they're not wearing any masks. They're going everywhere. They're traveling, and to be right today, New York added us to the list of people of places that they should people should not travel from. So everybody phases. And it's also like Illinois is a big state, so some counties, have to be in different stages. But it's all about following the rules. You could be outside on a patio, very socially distant. They take your temperature. You make sure that you're wearing a mask. You make sure that if you have any symptoms, you're not going outside and infecting anybody else, right? Or if you're been in contact with somebody who's COVID positive, you don't want to go spread that. You want to be sure that you're indoors for 14 days at least without seeing or touching anybody else. So once people hear those public health measures again and again, Dr. Allison Arwadi does a great job, doing that, but they need to follow the rules. So currently at this particular moment, yes, we are going to go slightly back and forth, closing bars, opening, closing restaurants, opening, that sort of thing. And it might go back and forth, but it's all about, as they said, what we do, wash your hands, sure.
So it definitely sounds like, and we know it, but it's good to hear the three of you, in sync, as well as myself. It's all of our responsibility, not you or you, but we all have to have some sort of accountability and take this serious and do our part. And I'm glad that you are here sharing it, because people need to be reminded of the wearing the mask, the washing the hands, the sanitizing, to stay in the social distance, because it is easy to get comfortable, especially when you have quarantined yourself and, you get that one little out and, you're ready to get out and have a good time and be sociable. And that's all great, but we are all responsible for bringing about some change, definitely. So I know everybody thinking and I don't know, you probably have conversations within your circle or when your family, is some of this our new norm, or how long do you think this norm is do you see it lasting over until next year and beyond, or by January would things kind of get back to life as we knew it before COVID-19?
So I'll go first. We at Loretto Hospital, we call it the new normal, because we have to go on for our patients. So we put into practice measures that are going to stay in place. People complain, people can have different feelings about it, but we are going to follow those measures. Temperature checks, questions at the door, social distancing, no less than 10 people in a meeting, doing everything over virtual, having all the correct protective equipment. We have, some of that has been very hard to source. I'm just putting it out there. For hospitals, it's hard to get them, especially if you don't have the money. But we want to do all that, and we just call it the new normal. We have to continue operations. And I believe that if we inculcate that into ourselves, we can sustain that for a longer period of time until we get there. So I'm hoping 2021, but I don't want to put any false hope, information out there, because nobody really knows.
Right.
Again, it's going to come back to how the people follow these rules and what's out there. So when the vaccine does become available, let's talk about the flu vaccine. I'm still shocked when I have people I talk to that won't get the flu shot. I'm like, okay, I'm going to make a bet that they probably won't get this shot either. Right. So if everyone gets the vaccine and you can, in essence, destroy this virus, we can be back to normal. But if you're having these back and forth and I don't want to do this and you can't tell me that, it's going to be an issue for quite some time.
And that's why I think at the hospital, we're very slow to ease any sort of restrictions, because we want people to understand the seriousness of this, and we want them to keep understanding the seriousness of this. So if we roll something back, they're going to think, oh, it's getting better. I can do this, this, and this, and that. And we'd rather stay at the level we're at until we can all breathe easier. Get what I mean?
Right. So I don't know about you guys, and I'll ask the question. But for me and my family and my circle, COVID-19 affected us personally. I lost what I consider my bonus dad, Jerome Butch McNeil, a man that was healthy, 70 years old, and he tested positive, was sick for a while, went into the hospital and never came out. I'm actually, this for me, I'm dedicating this show to him and to everyone that we lost to this virus. And I think it's important that people know, it's like we know if it doesn't affect you personally, it's like you don't get it. But it has affected a lot of people personally. So my question is, because we're winding the time down, it was very heartbreaking watching, not being able to visit him, seeing him only a few times via Zoom, and then ultimately losing him. And it was a great loss to my family, to my circle. So everyone, they definitely need to understand that it's real. We talk about it, we hear, we see it on social media. I know tons of people that had tested positive. Some beat it, and I've heard some really some stories about the whole process and really recovering from it. As we wind down in our time, I want to give each of you the opportunity to share some final words to our viewers as it relates to community health and COVID-19. And I'll start with Commissioner Deere. Are you there, Commissioner? Maybe not. So we'll come back. So Jack, what are your final words to the viewers?
Well, the number one thing, as I've said so far, is please be careful. Use the masks, do the hand washing, keep the social distancing, see the people you need to see, the family and all that, but do it properly. If you go out to the grocery store, have the mask over your mouth and nose. Having it down here on your chin doesn't help anybody. And these are very simple steps to try to get this disease away from everybody. If we don't do it, we look at these numbers in Florida, California, Arizona, etc., and they're skyrocketing, and the death tolls, it's crazy. So this isn't a joke. This isn't a hoax. This isn't a game. This is very important to play by the rules and do what can help you and your family and friends and the community at large.
Okay, great words. Did we get Commissioner Deere back?
Yes, I'm back.
Okay, so what you heard me talk about it affected my family. It became very personal. I know we always talk about people don't really get it until it affects them personally. Not sure if it affected you personally, but I've heard some horror stories even outside of my family. So what are your final words to the viewers as it relates to this pandemic?
So I agree with both the doctor as well as Jack. Everybody has to follow the rules. I don't have any family members that have it, but certainly I've had close friends who have gotten COVID. And I take that back because someone on my wife's side of the family got COVID. And I think we have to follow the rules and be overly protective, if you will.
Good point.
And I go as far as to even wiping off my steering wheel and my phone, and I keep the wipes on me. And one of the organizations I work with, we were just doing a reopening plan, and I bought me one of those temperature guns because I need to know what my temperature is at all times and people who are around me. And I mean, that's just my own personal stuff because because I have asthma, it's an underlying condition. I can't afford to get COVID,
Right.
and I can't afford for anybody to give it to me. And so I got to be overprotective. And then from a governmental standpoint, we are continuing to fight the good fight. We are working really hard for those working individuals who, may have been laid off to try to make sure they're getting employment. We got the $41 million, I believe, for contract tracing. So that's quite a few jobs that's going to come on board through Department of Public Health. I believe the city of Chicago Chicago Cook Workforce Initiatives, something like 5.6 million. And so I think some good things are happening to help people. But for people who are listening, the greatest thing you can do is to wear your PPE. Wear that
Mm,
face mask, wear your gloves, be concerned, be cautious, be overly cautious, and wipe everything off around you because COVID
right,
is real.
right. That's it. COVID is definitely real. So let's bring the doctor to share with us her final thoughts, final words to the viewers.
Yeah. So first of all, Yolanda, I'm sorry for your loss. We are
Thank you.
seeing a lot of that. Unfortunately, more than 600,000 people across the world have passed away, and so it is very real. I think unless you see it from the inside, where the only people that are with your loved one at the end are just the nurses, the doctors, the respiratory therapists, the people they don't know at the end. And all we can do is show pictures, try to get you on a video in time, that being the biggest thing. Very heartbreaking. We've had to explain to a family, to a daughter, to a mother, to a husband, to a son that you cannot let them in to
Hmm.
see their loved one. It is very hard.
Yeah.
And I don't wish that upon anybody, to be on either side of that.
Hmm.
So, from a mental health perspective, all of us are going through a huge
Yeah.
traumatic
Absolutely.
loss that is collective and worldwide. And we're going to need a lot of those services at the end. We were happy to be part of the initiative from Representative LaShawn Ford and others about mental health in conjunction with the pandemic, noticing the need for that. So I just want to say that yes, there is so much tragedy and trauma out there, but we can and we will get through this. Just please listen to us. We are not trying to make you miserable. We are not doing this for amusement, for our own fun. This is an everyday reality that all of us have to face. And I don't want it to get to the point where somebody who's been touched by it, because that just means that everybody has it.
Right.
At the same time, I don't want to talk to people who tell me that they don't know what we're talking about because they haven't. Because then they talk to somebody like you, Yolanda, and you've been through it.
Mhm.
So it's I get sad, I get angry, but at the same time I see wins, I see people going home. So there's good things
Yeah.
in that. And then
Yeah. Absolutely.
the thing with Loretto is we actually are possibly being considered for a vaccine trial. And so that would be huge community. And we want
Mhm.
everybody to understand that we're doing this for you. So at the end, I just want to say, please just be careful, listen, virtually hug your loved ones, talk to them every day, and
Right.
savor the good moments.
Right. Man, this is the Doty report on comprehensive health. We have had a phenomenal discussion about man, this pandemic that have, in one way or another, affected all of our lives. The health of our community is important. I mean, you heard all three of them talk about just follow the rules, you heard it from the doctor. I agree with Commissioner Deere. I had not heard it broke down in that way. That's why this show, definitely kudos to Georgia Doty Community Comprehensive Health Organization for this platform. Thank you for being an ongoing health advocate for the minority and underserved communities. It is so important. Oftentimes, we don't get the education or we don't understand it, and not because we're not intelligent, a lot of times we're overwhelmed and we just don't have access to quality health care or those resources. So thank you to all of my guests. I really appreciate you guys. The information was absolutely great. Again, for me, I have definitely, that's right. Wear the mask. Wear the mask. We have to wear the mask.
Bright logo on it.
Right. As annoying as it is for all of us, wear the mask. Thank you again. For me, I dedicate this show to my bonus dad, Jerome Butch, as everyone know him, and my viewers that are watching. There he is on the screen. We miss him. It was a terrible experience, and we don't want anyone else to have to go through that. So you heard it straight from the doctor. You heard it from the commissioner. You heard it from Jack, an experience in the healthcare industry. Wear the mask. You guys, wash your hands, and just be careful, be safe, and take it serious. Thank you so much. Thank you so much to my guests and my viewers. So before we end, I have an announcement that I definitely would like to share. We are going to have the Georgia Doty Comprehensive Health is adding another show. And I'm excited about that. And it is a much needed one because we know eating is very important. And what we eat is very important. And I know I like to eat good tasting food, but I also have began to realize how important it is that I know what I'm eating and I'm able to eat healthier meals. So I'm excited about on August 8th, Georgia Doty Comprehensive Health is launching a new show. It is so fully plated with Dr. Chef Drew, and I believe the chef is here to share with us a little bit about the show. Do we have the chef? Yay!
Hey, how's it going?
Hello, Chef Drew. So come on, tell us a little bit. Get the viewers excited about this show that's launching on August 8th.
Okay, so the show is called Soulfully Plated with Chef Dre. The show is going to have a spin on everyday foods that we enjoy on a day-to-day basis. We're going to figure out a way to create those meals, and we're going to spin them so they have a healthier take on them. The idea is to combat the obesity that we're seeing around the community. And so with this show, I'm excited, except myself, because these are some of the recipes that I've created myself, and we are actually implementing them in some of the things that I'm working with around Chicago. So yeah.
Okay. And what's the name of the show again?
Soulfully Plated with Chef Dre.
Soulfully Plated with Chef Dre. I'm saying Drew. Chef Dre. Then you're supposed to correct me.
Okay.
You're supposed to correct me. Congratulations. I'm very excited. Viewers, please save the date of August 8th. He looked like he can cook. We're going to share some great recipes with us. So I'm excited. Congratulations. I look forward to watching it. And I think I'm going to come in that location on August 8th so I can taste.
Good.
so I can be your first taste tester. How about that? Thank you, everyone. We have come to our end of our show. We're at 8:30. I had so many people watching on my Facebook page. I really appreciate all of the viewers. Once again, I give kudos to Georgia Doty Comprehensive Health Organization. If you want to know more about the organization, go to georgiadotyhealth.org. Don Doty is the founder and CEO, and he has been serving the Chicago community and being a very active health advocate and health educator for 20 plus years in the city of Chicago and beyond. Thank you so much. I really appreciate everyone. Again, wear those masks, social distance, wash those hands, and let's stay prayerful. Let's definitely stay prayerful. Thank you so much. This is again Yolanda Gibbons. I have been your host, and I will be back in 2 weeks. Have a great rest of the week. Thank you so much.